of our health talks. Our topic for today is menopause and perimenopause. And the discussion is about the whys, the whens, the hows, and what to do. So as we begin our discussion, let's look at the actual topics that we're going to be addressing. One, what is menopause? Common myths and misconceptions, the stigmas that surround menopause, what the symptoms are, the importance of early awareness, the various stages of menopause. We'll discuss what perimenopause actually is, and of course, the signs and symptoms of perimenopause. And then we'll discuss the lifestyle and health management of menopause, which includes having physical activity, healthy eating, and then identifying some of the other health risks that are involved with menopause and perimenopause. And of course, then we'll summarize the information, and I will then answer questions regarding the topic of menopause and perimenopause. So let's get started. So what is menopause exactly? It's defined as a time frame when women no longer have a period consistently for 12 consecutive months. Now, a lot of people aren't quite sure what that means, and they may have spotting during these 12 months. They may have a period 1 month and not a period the next month, or have a period for 2 or 3 months and then skip another month. There's no clear start or end for menopause as a date. You can't say specifically on the 12th week of the 11th month of February, you're going to be in menopause. That's not the way it works. Unfortunately, the human body makes up its own mind, and it does what it does. And for some people, menopause can last for years. I know you didn't really want to hear that, but it's true. Menopause can last a long time. So some of the common myths that are surrounded by menopause itself, and the misconception is that menopause starts at age 50. That's not necessarily true. Menopause makes you fat. That's not true either. And that everyone that goes through menopause is going to have hot flashes. Not everyone experiences hot flashes. So when we address these myths, we want to talk about the real truth. Menopause can start as early as in your late 30s to your 40s. And it's in the form of perimenopause. And we'll discuss what perimenopause is. And it's not menopause that makes women fat. The declining production of estrogen causes the body's metabolism to slow down. And many times women do gain some weight around this period, but it's more due to aging and lifestyle choices than it actually is menopause itself. As women grow older, your lean body mass tends to decrease. You tend to make less muscle, and body fat is then gained. This is because more women become sedentary as they grow older, leading to less calories being burned, meaning we're taking in more than we're burning that we had done previously as we were younger. And no, not everyone gets hot flashes, and some women don't get them at all. It's important to be familiar with all of the symptoms of menopause, not just the hot flashes. I know for many people, that's the focus because they feel like that is the most uncomfortable part of menopause. But we'll talk more about hot flashes in a moment. But I really just kind of wanted to address the things that people think about menopause that really aren't necessarily the facts. So, the common stigmatisms that are related to menopause. For some women, it's shame. They're embarrassed because they're going through a different cycle of life. And a lot of them associate this cycle with life with no longer being fertile, no longer feeling feminine, that they're old or they're unattractive, and that they have no purpose in life if they're no longer able to have children. And that's an issue that we have to address, not just as women, but as a community, as a health community. And we shouldn't be ashamed or embarrassed. This is a natural process that occurs in women. And women who feel that they no longer feel feminine because they're no longer fertile, that's an issue we have to address on a psychological, physiological level. Not being able to have children does not make us effeminate or effeminate. And growing older, that's unfortunately something that's going to happen to us. And growing older begins from the moment we are born. So when we talk about the symptoms, there are a lot of them. As you can see, looking at the presentation, this lists the 34 top symptoms of menopause. The most common of those are irregular periods, vaginal dryness, yes, the dreaded hot flashes. And for some, it's not just the hot flashes, it's alternating between hot flashes and chills, night sweats, difficulty sleeping, extreme mood changes, weight gain, and slower metabolism. And for some, it can be as many of these others that we have listed here, from memory lapses to loss in libido, joint pain, brittle nails, hair loss, difficulty concentrating, these feelings of electrical shocks, gum problems. For some people, the gums become very sensitive, headaches, body odors, and the list goes on. It's important that you have the ability to understand that these things occurs. Not every one of these symptoms is going to occur for every woman. But if you are having any of these symptoms, they can be associated with this period in time when you're going through the cycle of menopause. This list is available through a website called menopausenow.com for anybody that wants a copy of this list. And of course, it is on this slide. So when you receive the slide presentation, you will have these symptoms as well. So why is early awareness of menopause important? Well, first of all, menopause can lead to a range of changes in your body. And this may help to increase your risk for other health problems. Changes related to typical ages, such as weight gain, lower levels of estrogen and progesterone, can lead to increased risk of heart disease, stroke, and osteoporosis. So this decrease in hormone production puts you at higher risks. So other important factors regarding early awareness. Why is early awareness important? Well, over 75% of the women surveyed in a trial felt like their menopause increased their stress levels. 84% of women say that the symptoms interfered with their daily life. 12% of women experience debilitating symptoms. I mean, symptoms that they felt they could not get out of bed. And then 42% of the women surveyed never spoke with a healthcare provider during this cycle in life, which again puts us at risk for other health conditions. Only 1 in 5 women receive a referral to a menopause specialist. So early awareness of menopause becomes very important because it is a time in our life when we should be seeking healthcare professional opinions. We should be understanding what our body is going through. And then we should be given information on how to relieve some of these symptoms. So it's also important to know that various ethnicities experience menopause at different times. 85% of women reach menopause naturally at about the age of 45 to 55. A 2008 study published in the American Journal of Epidemiology found that African American and Caucasian women experience menopause at a similar age onset. But Latino and Native Hawaiians experience menopause earlier than Caucasian women. Japanese women experience menopause later than Caucasian women. An early age or premature menopause is most likely to occur among Hispanic women. The rates of premature menopause are higher in Asian and Pacific Islander women, with an average age of about 41 to almost 50. So knowing the onset based on your race and ethnicity is important to you, because then you know to expect this as you approach these age limits. So, did you know understanding potential ethnic differences can contribute to your unique menopause journey? Knowing the difference in racial and ethnic onset of menopause can help better prepare you in knowing the symptoms, knowing what your risk factors are, and when you might reach menopause. It also helps to dispel some of the concerns that you have regarding the changes in your body. So looking at the stages of menopause, there are basically more than one stage. The first stage is perimenopause. It's the first stage of menopause, and it begins about 8 to 10 years before menopause actually takes place. The actual phase or stage of menopause is the second phase, and it's the point when you no longer have a menstrual period. For most women, this occurs somewhere around age 45. And menopause happens because the ovaries stop producing estrogen and progesterone, which are the same hormones that make our skin soft, lower the tones in our voice, help with hair growth, nail growth, those feminine features that we have that men don't. And the third stage of menopause is postmenopause. That's the final stage after menopause, and it's when the symptoms have declined or completely ceased. So again, looking at menopause itself, between ages of 35 to 45, most women are still in their normal productive stage of life, childbearing, if you will, and they have a higher level of estrogen and progesterone. And about 35 to 45, you start to see the changes in the frequency of menstruation or periods. And then between 45 and about 50, we start to experience those last menstrual cycles. That is the onset of menopause. And then postmenopause occurs when those symptoms and the periods themselves have completely stopped. And that's anywhere from about age 45 on. And as we discussed a few minutes ago, that can occur at different times for different ethnicities. So looking at it, menopause itself is a decline in our ability to produce specific hormones. So what is perimenopause? The word peri means around. So perimenopause would be around menopause. And it refers to that time where the body starts to make this natural transition. And it marks the end of our productive cycle. It's also called menopausal transition. Perimenopause often starts with small, minor changes in your menstrual cycle. Some you may not even notice immediately. But during this stage, the ovaries begin to produce less and less estrogen and progesterone, as well as decreasing periods begins, and fluctuation in those periods often occur. So with that lack of ovulation, with that progesterone not being produced to make ovulation occur, there's a thickening of the uterine lining, and that also affects the production of hormones, which then causes those irregular periods. So during this phase, the body is shifting from the mode of childbearing and reproduction to, if you will, shutdown of the factory. So signs of perimenopause. As you guys can tell, I love this picture because I can relate to how that felt. Okay. The symptoms of perimenopause can be insomnia, increased irritability. You know, most men say, you know, they can tell when a woman's going through menopause because they have to hide the kitchen knives. But these changes in our body affect us both physically and emotionally. There's the hot flashes, the irregular periods. It can lead to vaginal dryness, skin dryness, a decrease in our libido, fatigue or lower energy, water retention, holding fluid, which also is reflected as a weight gain. It can lead to headaches, difficulty becoming pregnant, or infertility. People tend to notice problems getting pregnant as they start to approach their stage of perimenopause because the cycles are then irregular. So let's talk about some of these symptoms. Hot flashes. Hot flashes can come on suddenly. They're intense feeling of heat that typically affect the face, the neck, the chest, and they're very common during menopause, but they also can occur with other conditions. Hot flashes basically are caused by hormonal changes during menopause, the decline in the estrogen production, as we've talked about already. And this can disrupt the body's temperature regulating system. There are other hormone imbalances that can cause these hyperthyroidisms or other medications that can cause hormone fluctuations that can lead to hot flashes as well. Now, one of the questions that was asked was, what is the injectable medications that physicians use to address hot flashes? Well, hot flashes are actually vasomotor symptoms that occur due to the fluctuation in hormones. And one of the medications that has been approved by the FDA is called phazolutardin, or the product name of Zeoha, and it's spelled Veoza, Veozah. Now, this medication, it comes in two forms. It can either be injectable, and now they have an oral medication that assists. But there are some side effects that you need to be aware of, one of them being the possibility of hepatotoxicity. Hepatotoxicity is toxicity or poisoning of the liver. So if on those medications, the liver function must be monitored very closely. Back to what we were talking about, chemotherapy and radiation therapy can affect the production of hormones, and it can damage the hypothalamus. And the hypothalamus is the body's temperature regulator. It's our body's thermometer. And so chemotherapy can affect that thermometer, which can then lead to periods of chills and hot flashes. The symptoms of having these hot flashes are this sudden feeling of intense heat, flushing of the face, neck, and chest, sweating, chills after the hot flashes subside, increase in your heart rate, anxiety, or the feeling of suffocation. For some people, they describe it as feeling like they're on fire. And a common symptom of having the hot flashes, as most people who have a partner, is the kicking off and the pulling on of the covers at night. The covers are on, the covers are off. I'm hot, I'm cold. Can you turn the air conditioner on? No, can you turn the heater on? And it just becomes a miserable time for women going through these conditions. So there are other issues that can occur with menopause. Urologic issues, such as urinary incontinence, urinary tract infections. And urinary tract infections can be common during perimenopause due to, again, that decline in estrogen levels, which can affect the urinary tract's ability to control urine and make women more susceptible to urinary tract infections. Urinary incontinency, I can't talk today, reduces the estrogen levels, which can cause weakening of the pelvic floor muscles and the urethra, making it harder to control urination, and it can also lead to leaking. Urinary tract infections. The estrogen is what helps to maintain a healthy vaginal environment. And as it declines, or as that estrogen production declines, it can make women more susceptible to developing these urinary tract infections. And then there's the overactive bladder. Estrogen decline can also contribute to overactive bladder. It's a condition that is characterized by the sudden urge to urinate and difficulty holding it, or urinary urgency. It's that thought that you have to go to the restroom now. And so all of these issues have a direct correlation with the decrease in the amount of estrogen that the body is able to produce. So when we look at health and lifestyle management, how does having menopause affect us? Well, first thing we need to remember is that each woman experiences menopause differently, and different changes work for different women. So when we address lifestyle management, this is a generality. It is not a specific, it is not the golden answer for every woman. So how do we ease some of these symptoms of menopause? Well, physicians have assisted women in easing the irregular periods by using low-dose birth control. That is an option for individuals who are non-smokers. Smokers on low-dose birth control can increase the risk for cancer. The use of progesterone-like hormones can help control the heavy bleeding. The vaginal dryness. Of course, now there are over-the-counter moisturizers that are available to relieve some of the symptoms of this dryness. But it's recommended that you talk to your healthcare provider before you start using these creams and other medications. The symptoms. Easing the hot flashes. As I indicated a few moments ago, there is now a medication to help to do that. And it is by prescription only. And that medication, again, was Veozah, Veozah. Okay. But to naturally address some of the issues with hot flashes, it's important that you know some of the things that you can do. One, wear loose clothing, comfortable clothing. It also helps to keep the temperature stable. and trying to keep it cool. Some women also recommend deep breathing exercises to help manage those hot flashes. Some women with severe symptoms may be prescribed estrogen or other hormone treatments for short-term relief of these hot flashes and night sweats. For women at high risk of osteoporosis, healthcare providers may also prescribe hormone treatments that are an effective tool to prevent osteoporosis. So these are things that can be done. So what can I do to manage the menopause? Well, generally speaking, exercise, being more active, eating healthy, making sure that you're getting enough rest. And now, start now. There's no need to wait until you're menopausal to start being active, eating well, and ensuring that you are getting the proper rest you need and finding a stress-free environment for you, even if it's 10 to 15 minutes a day. Staying active. There's an increased risk of heart disease as we as women grow older. Regular aerobic exercises can reduce your risk for heart disease. Regular physical activity can help to relieve mild to moderate depression, as well as improve your self-esteem. Exercise such as jogging, strength training, and things like yoga can help increase bone density to help prevent osteoporosis. When we talk about eating healthy, one, we want to reduce our caffeine intake. Why is that? Caffeine can trigger hot flashes. Eating foods that are high in omega-3 fatty acids can help decrease the inflammation, improve your mood, as well as decrease depression. Eating foods high in fiber can help you feel fuller longer and prevent that snacking or that overactive appetite, which again can cause increased weight gain. Eating foods high in calcium can help to reduce the risk of osteoporosis. You want to limit your intake of refined carbohydrates. That's all those goodies that we talk about, such as the breads, the pastas, the baked goods, the cookies, the candies, the cakes, and the pies. We want to reduce or eliminate saturated fats and caffeine from our diet because they can reduce the menopause symptoms when we alleviate those foods. And again, we want to avoid frequent fast food and processed food consumption. So when we talk about the health risks that are associated with menopause, menopause can lead to a number of changes in the body that increase your risk for a number of different health problems, to include depression. Changes related to just simple aging, such as weight gain and lower levels of estrogen and progesterone, can lead to increased risk of heart attacks, strokes, and osteoporosis. Now, when we talk about depression in menopause, it's important that we're aware of the risks of depression during menopause. Many women don't acknowledge the symptoms of depression, and for many women, that is a major issue during menopause. In a study of women's health across the nation in 2013, it was concluded that 3,296 women, individuals, were more likely to experience depression during perimenopause and postmenopause stages. A study that was conducted by researchers at the University of Pittsburgh tracked 221 women that had symptoms that were perimenopausal in stage and all found to have about 30% of them experiencing at least one major episode of depression. So depression can be a very serious and very real part of menopause. So what should you do? Well, you should discuss any concerns you have about menopause with your primary care provider. He or she can work with you to identify the necessary resources for you and lifestyle management changes you may need to help you to manage menopause itself. So let's talk a few minutes about perimenopause. What is perimenopause? Well, it's the period following menopause. It's defined as 12 consecutive months without a menstrual period. Now, during the time of menopause, you may have periodic stops where you go a couple of months and don't have a period, and then you have a period for 2 or 3 months, then you have another. That's not postmenopause. Postmenopause is when you no longer have a period. And this typically occurs between about age 45 and 55, with the average age being about age 51. But there are individuals who don't experience menopause until they're in their late 50s or early 60s. There are health changes that take place. While some menopausal symptoms are like hot flashes may subside or disappear in the post-menopausal phase, new health conditions can emerge, such as the risk for osteoporosis, heart disease, and other conditions. These hormonal levels, which fluctuate during perimenopause, become low and stay low in postmenopause. Some women experience that postmenopausal weight gain, the urinary symptoms we discussed, vaginal changes that affects their sexual health. Some even experience hair loss, brittle nails, dry skin. And in long-term stages, once the postmenopause has occurred, some women remain in this stage for the rest of their life. And so postmenopause doesn't necessarily go away for all women. So when we talk about some of the treatments for menopause and postmenopause, as well as perimenopause, hormone therapy or hormone replacement therapy is one of those that is discussed regularly. There's no fixed duration for postmenopausal estrogen therapy. It is based on the individual, and the benefits versus the risks should be carefully considered. The treatment should be reviewed regularly with a healthcare provider. Hormone replacement therapy is an individualized approach. This decision on how long to continue estrogen therapy depends on a woman's individual circumstances, including her symptoms, her health history, and her risk factors. The benefits versus the risks are that estrogen therapy can offer benefits like relief from the symptoms of menopause, such as the hot flashes, the vaginal dryness, and may help to reduce the risk of osteoporosis and fractures. But it also carries potential risks, such as the risk for the increase of breast cancer, blood clots, and strokes. It's crucial that if you are on hormone therapy, that you have regular discussions with a healthcare provider to assess what's going on in regards to the benefits and the risks of estrogen therapy, and receive treatment adjustments as you are on these plans. Short durations. The general recommendation when it comes to using estrogen therapy for short durations, necessarily managing the symptoms and reducing the risk, meaning you want to use the estrogen therapy for as short a time as possible to relieve the symptoms. And once the symptoms have subsided, then you should, one, taper off the estrogen. As these symptoms improve and the risks increase, a healthcare provider may recommend gradually reducing the dose of estrogen or discontinuing the therapy altogether. So again, the things that you need to consider when it comes to this the estrogen therapy is your age. If you are 60 or younger and experience menstrual symptoms, hormone therapy might be appropriate for you. If you started menopause within the past 10 years, hormone therapy might be appropriate for you. If you have a history of blood clots, breast cancer, heart disease, the coronary artery disease, active liver disease, uncontrolled high blood pressure, or undiagnosed genital bleeding, hormone therapy is generally not going to be recommended. And if you have a family history of cancer, cardiovascular or heart disease, dementia or stroke, this is something that you should, one, discuss with your provider and make sure they know the family history, because it could possibly increase your risk for some of these same conditions. So, key points to remember. Menopause is a natural transition that occurs in a woman's life. There's no single test or sign that's going to let you know that a woman has entered menopause. Doctors must consider everything from your age to your menstrual history to the changes you are experiencing to actually be able to determine if you have entered menopause. It's important to know how menopause can impact you as early as possible so that you begin making good health and lifestyle decisions to better manage these symptoms as they occur. Knowing what to look for can help you so that you can share these changes with your healthcare provider. It's important that we recognize these symptoms that are occurring so that they can be discussed and be addressed. So, in closing, I'd like to address some of the questions that were posed early. How long should a woman continue to have gynecologic exams? Well, the Area Council of Government recommends that pelvic exams, including a pap smear, start at age 21, whether a woman has become sexually active or not. And there's no set age for when a woman should stop having gynecologic exams, although pap smears can be stopped for low-risk women after the age of 66. Do urologic issues start to occur during menopause? Yeah, we talked about that just a little bit. But the urologic issues, such as this urinary incontinence, UTIs, vaginal dryness, these things can occur during perimenopause due to the decline in estrogen production and those estrogen levels that can affect the urinary tract's ability to urinate and make women more susceptible to these urinary tract infections. What are hot flashes and where do they come from? Well, hot flashes, again, that's that intense heat that typically affects the face, neck, and chest. They are a common symptom of menopause, but can also occur because of other hormonal changes. So I know there were other questions, and so I'm going to take a moment and try and go through some of those questions that we didn't answer previously. One of those questions was, just around 34, I noticed my period was starting to be irregular. I did my own research and started taking estrogen pills. It seems to have gone back to normal. And now I read it could be due to the perimenopause. Is that correct? Yes, you can be experiencing perimenopause, and the taking of estrogen is actually bringing the estrogen levels back up, which causes those symptoms to subside. However, that does not prevent you from growing through those stages of perimenopause and progress on to menopause. And just as a warning, you should be consulting a physician if you are taking estrogen or progesterone supplements because of the risk for other problems that it could cause, especially if you are a current or a past smoker. Another question was, is sweating and always feeling sad because of the need of estrogen? The decrease in estrogen levels can cause mood changes, and those mood changes can lead to irritability and depression. So to answer your question, yes, those can be caused because of the perimenopause or menopausal stages. And that is, again, something that should be addressed with a healthcare provider, because there may be short-term medications or activities or lifestyle changes that can help to reduce those symptoms for you. If I had a uterine ablation, will I have the same symptoms as those with a DNC? The answer to that is it is specific to the individual. Some women naturally produce more estrogen and progesterone as they begin their menstrual cycles, which continues through up to the point they become perimenopausal. And then there are other women who produce lower levels of estrogen and progesterone. And as they progress through those, of course, then their decrease in the production becomes more significant. And so the symptoms that you experience really are not related to the ablation or a DNC. It is more the symptoms that are related to the actual estrogen and progesterone production that remain. I'm hoping that I'm answering that question for you. Are there any vitamins to take that going through perimenopause can be beneficial? Well, there are a number of vitamins. Of course, making sure that you are taking plenty of calcium, vitamins. A woman's multivitamin generally is what is recommended. And for women going through menopause, you may also experience lower iron levels. So you want a women's vitamin plus iron. You want to, more than worry about drug supplements, it's important that you're eating healthy to make sure that you are getting enough of the necessary macronutrients that the body naturally needs to intensify or to maximize the hormone productions that remain. How long does perimenopause last? Well, I think we kind of addressed that. Perimenopause can last for years for some women, and for others that may be shorter. And again, as we discussed, it can be based on your ethnicity, your race, your lifestyle, your family history. There are a number of factors that determine how long an individual goes through each of these lifestyle or life-changing cycles. I addressed the question about the shot earlier. Someone asked, what is the shot that the doctor uses to deal with hot flashes or symptoms? We've already talked about that. One of the questions was, how early can perimenopause start? At what age? We kind of touched on that, but perimenopause can begin as early as the late 20s or early 30s. It again depends on a number of different factors. There are questions about resources and where to find some of those. One of the best places to find information about menopause is the National Institute of Health, the Women's Coalition of Health, Maternal Health. These are all sites that can help to provide you information and resources on proper care and management of the stages of menopause. And one of the other questions again was, is itching breast a symptom of menopause? It can be. Again, there are a number of symptoms that are experienced in different people. Again, you saw the list of about 34. So that tells you there's quite a few of them out there, and they're going to be specific to the individual. Again, though, of course, breast development, breast tissue, and the expression of the mammillary glands are all based on hormones. And again, menopause being a reduction in progesterone and estrogen, which means or implies that, yes, that affects the breast and breast tissues as well. So I believe I have addressed most of the questions that were asked. At this time, I'm going to ask you to take yourself off mute if you have any additional questions, and I will do my very best to answer those.
So we do have some other questions that were sent via chat. If I've had a hysterectomy, do I need to get yearly pap exam?
It is recommended that if you've had a hysterectomy because of cancer, yes. If you've had a hysterectomy due to such things as polycystic ovarian syndrome, or if it was a lifestyle choice, it's recommended that you still have PAPs up to about age 65. Beyond that, if you don't have a cervix, there's not a need for a pap smear, because what the pap smear does is test the tissue of the cervix.
Okay, one of the other questions is hearing about a drug for hot flushes or night sweats. How long have they been available, and what have the studies shown as far as the negative side effects?
Very good question. Well, the medication that I was just telling you about is a medication that the FDA has approved for vasomotor symptoms. One of those vasomotor symptoms is hot flashes. According to the information that I was able to find, they were approved by the FDA a little more than 4 years ago. And they started out as an injectable only, and now have gone to an oral dosing of those same medications. Again, one of the biggest risk factors or concern are liver damage. There are some other side effects that can be experienced with that, some of those being digestive issues. Unfortunately, that seems to be a common side effect with a lot of the medications that are coming out now. They can cause nausea, vomiting, irregular bowel movements, constipation, gas, bloating, some of that. My suggestion would be, if that is something that you are interested in, please talk with your gynecologist about those medications. One, they do require a prescription, but I think they could probably go into much more detail in regards to your risks and benefits of the medication.
Okay, one of the next questions is, if you have had a partial hysterectomy, would that affect menopause?
Yes, it can. Partial hysterectomies, if the ovary has been removed, the ovum is where the actual hormones are produced. And if you lack an ovary, that means a decrease in the production of those hormones, which can, in effect, bring menopause on sooner.
What type of labs should we be asking for? Is this something our primary care doctor or our gynecologist should be advising and monitoring for us?
Well, like it said, there's no specific test to tell you if you are in menopause. It's based not only on your symptoms, your overall health care itself, your health condition itself, and generally the labs are going to be the same that you have any other time. It's going to be a complete blood test, a CBC, a chemistry, a urinalysis, which would help to detect if there's a urinary tract or bladder infection. But there's not a specific lab test that's going to say whether or not you are in menopause. We normally don't test estrogen or progesterone levels because they vary in individuals anyway. And what may be a progesterone level for one person and that be their normal level may be low for another individual. So that's one of the reasons that's not done.
So taking hormone medication can be at a higher risk for breast cancer.
Yes. Absolutely.
I was given samples of natural supplements for hormone replacement since I have had a heart event. Though those are very expensive and they were not effective. Are there prescribed medications or natural supplements that do not cost a lot?
Off the top of my head, no. There are not a lot of supplements that I am aware of that are inexpensive that can relieve the symptoms for menopause. Any other questions?
Yes. There is now a trend that I notice more women over 50 are taking semaglutide and other medications to lose weight related to menopause. I've been contemplating this, but there are risks, and is it smart? I've got a thing that's blocking it, so I can't read it. But there are risks, and is it smart with all the changes in the body? I have tried everything, and I'm starting to think I will never lose the weight in my stomach area. I'm in postmenopause. Is it really safe?
Semaglutide, first of all, is a medication that was designed to reduce insulin resistance, meaning it was designed to help an individual who has low insulin production utilize all of the insulin that they do produce. The weight loss was a unintentional side effect that has now become very popular. As a proponent for the use of semaglutide for diabetics, I say semaglutide is a wonderful medication to help control diabetes and to help to reduce weight to manage the diabetes. For weight loss itself, one, that's an individual choice. Two, it does come with some risks. And three, a lot of people don't understand that as long as you're on the semaglutide, you will reach a plateau and will need to escalate to the next level if the weight loss is to continue. And once you're off the medications, the body resorts back to its natural state. So that means for some people, they will gain that weight back. So my best suggestion to you is to talk to an endocrinologist about the use of semaglutide for weight loss before making the decision to use it.
One of the other questions is, who is or how does one find a menopause specialist?
Your gynecologist is going to be your menopause specialist. And if they do not feel the condition that you are experiencing is something within their realm, then they are generally the people that are going to refer you to a higher level of care.
35 going on 36. My periods have been on time around 28 to 30 days, but my cycle days last 1 to 3 days, and the rest of the days are spotting. Also, I have huge blood clots now.
You are approaching menopause. You are in perimenopause.
If I tie my tubes at a young age, can that cause me to be in postmenopause?
Again, tying the tubes does not prevent you from, or does not increase when you become menopausal. Because even though the tubes are tied, you are still producing eggs or ovum. And that is where the estrogen and progesterone are produced. So as long as you still have actively functioning eggs, then having your tubes tied does not change or impact your normal cycle of transition from premenopausal to perimenopausal to postmenopausal.
I'm 35 with long COVID. I have ongoing issues and symptoms that I suffer from. When perimenopause hit with its own symptoms, how can I manage? Workplace accommodations, I've only recently been able to work since 2020.
I'm not quite sure I know how to answer that. Is she asking what other accommodations are available in the workplace? Or can whoever sent that kind of clarify that question for us, please?
Sounds like they're having issues with the long menopause, but with perimenopause, with its own symptoms, she's having difficulty managing both.
Managing both. Again, when you're having to deal with both, that's going to be something that's going to require very, very close monitoring by a menopause specialist, because you're dealing with hormonal issues on different levels, and there are certain medications or certain things that can contradict one another. So at this point, if you could be a little more specific about the symptoms, I might be able to give you a little bit more detailed information.
Multivitamins such as Centrum over 50 is okay to take?
Yes, most definitely, because it provides a good amount of calcium for the bones, vitamin C. The only other thing that I would recommend is if it's just the Centrum you want the Centrum for women, the 55 plus with iron.
Okay, I think you already answered this question about who is or how does one find a menopause specialist with the
go through your gynecologist.
Next question is, are supplements not healthy to take? Can we get those through our health provider?
Most of your supplements are going to be over the counter. It is very rare that you would have a provider prescribe a supplement, and generally it's not going to be something that your insurance is going to cover on an ongoing basis, especially if it is available over the counter. But my recommendation is before starting any supplements, it's important that you talk with your healthcare provider and take a look at what other medications you may be on for whatever other conditions you may have. Because sometimes taking supplements can affect the performance of other medications that are designed to improve your health.
The next question is going back to the other one. Are there workplace accommodations for menopause?
That is generally going to be based on an employer level. The employer makes that decision. I don't think that there's any mandatory regulations in regards to those type of accommodations, but I would suggest getting the facts straight from the horse's mouth, if you will. I would contact the American Disabilities Association and ask that question. Are there regulatory accommodations for individuals suffering with menopause? There may be, because we now have regulations for breastfeeding. So that is a possibility, but to my knowledge, there is not one.
What is a natural way to increase progesterone?
Believe it or not, exercise and healthy eating.
If there are any other questions, if you want to post them in the chat. Oh, here's one more. When an OBGYN doctor checks your estrogen levels in labs, what number determines if you need HRT, creams, patches, etc.?
I'm going to be very honest with you. I don't know. I don't know specifically, because I know that there is a range, but I don't know what that range is off the top of my head. I can do some research and we can follow up with the answer to that question, but I apologize. Being very transparent, I don't know the answer to that question.
Is there a natural way to increase estrogen?
Again, increasing both of those, estrogen and progesterone levels, healthy diet, vitamins, getting plenty of rest, the things that we talked about in regards to managing menopause symptoms.
Does going into menopause increase breast cancer?
The risk for breast cancer does increase as we age, because the lack of progesterone and estrogen allows the potential for irregular cell growth to occur. And a cancer is an irregular accelerated cell growth. So yes, to answer that question, as we get older, we become more at risk for developing cancers. But that comes with the decrease in hormone production of all types of hormones.
Any recommendations for fiber supplements?
Roughage. Foods that are lean, green leafy vegetables. Fruits that we consume the skin on. Apples, pears, peaches, plums, nuts, beans, whole oats, whole wheats, and grains all contain large amounts of fiber. Things like sweet potatoes versus white potatoes are going to contain more fiber. And fiber generally helps the body in a number of ways. One, it blocks some of the digestion of carbs, which turn to sugar, which then turn to fat in the body. Two, it helps with gastric motility. People say, well, what does that mean? What does fiber make you do? Makes you poop. And removing the waste from the body is a healthy thing. Fiber helps to provide a number of vitamins and minerals. It is considered one of our essential macronutrients. And there are a lot of ways to get fiber. But what you should be aware of is that not all fiber is dietary fiber. And so people think that by taking fiber tablets or drinking fiber liquids, that they are getting all of the essential fiber that they need. but you need to heed the warning. Not all of that is dietary, so not all of that fiber is necessarily beneficial. Sawdust is fiber, but it doesn't seem to help the human body. And by the way, if you're buying cheese that's pre-grated and processed in a bag, the way that they preserve that is micro particles of sawdust.
Is there another medical issue for getting your period after 13 months of not having one?
There can be. There can be a number of issues. PCOS, which is polycystic ovarian syndrome, can cause that. Dysplasia can cause that. STDs can cause that. There are a number of things that can cause those severe fluctuations in the period. It's not just not having the period, it's what symptoms are occurring with that can help you to identify the actual problem or the cause of the problem.
I was having menopause symptoms, including vaginal dryness, and the doctor told me that my hormone levels weren't close to menopause, just my testosterone a little low. Why is that?
Well, females have a small amount of testosterone. Well, not a small amount. We have an unequal amount of testosterone in comparison to our progesterone and estrogen. But if we don't have testosterone at all, then it doesn't provide the balance that the body needs for proper growth and development. And so a lot of times as women approach menopause, you have that decline in both, or a decline in all of hormone production. And if you had small amounts of testosterone to begin with, and then you have a reduction, then that further offsets that balance. And so one of the things that you can do in helping to raise those testosterone levels, believe it or not, again, exercise, muscle development.
To decrease breast cancer, is it safe to take hormone medication?
That is an individual question, but to answer it in generality, it depends on your health history, your family's risk for breast cancer. That's a hard question to answer without knowing you or your family medical history, because breast cancer tends to run in families, and the risks increase as we start taking hormonal supplements.
I'm allergic to certain birth controls and was placed on the mini pills. Is that pill too low of the dose with estrogen or progesterone?
Again, that to answer that, I would need to know what your levels are and what the dose is of the mini birth control.
So this question, you say to get plenty of sleep, but if we have trouble sleeping, how can we get enough rest if menopause causes us not to? What can we do in order to get enough sleep?
First of all, the problems that are generally associated with the insomnia have a lot to do with the hot flashes or the other symptoms related to menopause. So by relieving some of those symptoms, you tend to get better rest. Again, you guys must think I am a proponent for exercise, but exercise can help you to find that place of relaxation so that you get more rest. Another thing that's recommended for people in general with insomnia, turn off the computers and the TV and the electronics before an hour before going to bed to give the mind time to quiet down. Things like nature sounds, soft music, soft lighting, not having heavy meals just before you go to bed, moments of meditation, all of those things can help you to get the rest that you need. And for some people during menopause, they need help with sleeping, and they may need to be prescribed something to address their insomnia.
What other hormones besides estrogen and progesterone should we be keeping an eye on?
Your thyroid levels produce synthroid in the body, your insulin levels. With age comes a reduction in the production of just about every hormone we make. And if you are maintaining regular visits with your primary care physician, you are being tested and those hormones are being evaluated based on the lab results that you're getting. And generally, that's not even something that your doctors talk to you a lot about unless they're abnormal. And so that's not a big concern because it is a natural part of aging. But when those hormone levels become significantly low and start to produce symptoms, that's when they're being addressed.
3 days before the year of not having periods, I had one for 1 day and haven't had one after for 3 months now. Am I over them?
Again, I can't answer that because you could go 3 months without a period and then next week have one that lasts 10 days. Um, it's hard to say. Like I said, diagnosing menopause is not an exact science. It's based on the individual themselves.
Okay, I think we have one more question and then we're gonna, because it's already after 1. Are supplements not healthy to take? Can we get those through our health provider? I think you've already
I've already answered that. Yeah. Supplements are generally okay to take once you've communicated with your provider on what supplements you're taking and what other medications you may be on and what health conditions you have.
Okay. So I do greatly appreciate, these are a lot of great questions. I greatly appreciate everyone joining today. And once the recording is available, I will send that out to everybody. It will also have the answers to the questions that Terry just went through as well. But again, I greatly appreciate everyone being here.